Okay, hygiene. Hi, my name is Melody. I'm your nurse. I'll do a head-to-toe assessment today on you. Is that okay?
Yes.
Okay. The patient is a well-developed, well-nourished 44-year-old female with no acute distress. Can I ask you a few questions? You answer them to the best of your ability. What's your name?
Raquel Jones.
Date of birth?
8/24/80.
What's the year?
2025.
And who's the president?
Trump.
And why are you here?
Physical exam.
The patient's speech is clear and coherent. So, the patient is alert and orientated times 4. She's awake, alert, and orientated times 4. Okay, so I'm going to do something to test your muscle strength. I'm going to put my hand on your face and you just turn your head against my hand. Hold your head back, down, down, shrug your shoulders. Okay, squeeze my fingers as high as you can. I want to put my hand down here. I want you to put your hand and press on me like some gas pedals. Alright? Put your arms up like this. Don't let me push them. Don't let me pull. Don't let me push. Alrighty. So the patient's muscle strength is 5 out of 5 on a scale of 0 to 5. Her muscle strength is strong and equal, symmetrical, bilateral in upper and lower extremities. Now I've assessed your muscle strength. So now I'm going to touch you in a few areas. Now if you tell me where I touched you and what you feel, okay? Do you feel that?
Yes.
Look straight at me. What do you feel?
Little pressure.
Is it soft or sharp?
Soft.
Where is it?
My wrist area.
What about this?
Soft
Soft or sharp?
that. A little sharp.
Where?
Wrist.
Feel this?
Yes.
What's that?
Soft. Shoulder. Soft left shoulder. Sharp left foot. Sharp leg. Soft leg. Sharp foot.
The patient's sensation is intact and in upper extremities and lower extremities. Her sensation is intact. Now I'll check your sensation. Now I want to check your deep tendon reflexes, okay? So I'm gonna take your arm, just let your arm just kind of hang, okay? Bicep. Let your arm hang. Tricep. And get your patellar reflex right here at the knee. Under your ankle reflex. And if you can get down here, Kendall, I'm going to do the Bushinski reflex on her. Okay. Do it on the other side. Brachial. Biceps. Biceps. Radialis. Patellar. Ankle. Bushinski. Can you stand up for me? We're gonna walk. Get it good, Kendall. So I want you to walk forward this way 5 steps. 1, 2, 3, 4, 5. Walk backwards on your heels. Alrighty, walk 4, 5 on your toes. Alrighty, and I want you to walk with one foot in front of each other in one single file line. Okay, thank you. Now I'm going to inspect your head, ears, eyes, nose, and throat. Look straight at me. Follow my finger. Pupils are equal, round, reactive to light and accommodation. I'm not checking your NURS. I note no nasal flaring. Can you open your mouth for me? I know no circummoral cyanosis around the mouth. The mucous membranes are moist and pink, and there's no pursed lip breathing. Thank you. Now I'm going to inspect your neck and your throat. I see no accessory muscle use. I see no jugular vein distension. I will now palpate your carotids. One at a time. Palpating the carotids, I note no thrills. I'll now auscultate the carotids. Okay? And now listen to your neck, the arteries on your neck. I want you to hold your breath. Hold your breath now. Breathe normally. Hold your breath now. Breathe normally. I auscultate no carotid bruits. So now I'm going to, I went over your head, ears, eyes, nose, and throat. I have auscultated your neck. Now I'm going to look at the symmetry of your chest wall. I'm inspecting your chest wall. I see no barrel chest, no scoliosis. I see no bruising, no barrel chest, no scoliosis, no bruising, no venous patterns, no engorgement of the veins around the umbilicus. I will palpate the lung fields. Go to the back. Now I'll auscultate her lungs with the diaphragm of my stethoscope. Deep breath in and out. I'll get the lateral lung sounds. Right lung, lateral on the left side. Now go to the posterior. Her lung sounds. 8 areas on the back. Breathe. Breathe. In and out. In and out. In and out. Breathe. Last time. Breathe. Breathe. So I have inspected her chest wall. I have palpated her chest wall. Now this is her lung sounds. The lung sounds are clear in the anterior and posterior lung fields. There's no crackles, no rhonchi, no wheezes noted. Now I would assess her cardiovascular system. I'm looking at her cardiovascular area. I'm looking at her anterior chest wall. I'm looking over the valvular areas of her heart. I see no abnormal heaving, no abnormal vibrations. I see none of that across the valvular areas of the heart. I'll now palpate the valvular areas of the heart. I don't feel any thing that's abnormal. I don't feel any abnormal lung vibrations. I don't feel any thrills. So I will listen to the valvular areas of our heart with the diaphragm and bell of my stethoscope. I will use the diaphragm and bell of my stethoscope. I will now inspect the valvular areas over her heart. I'm inspecting the valvular areas of her heart. I see no abnormal vibrations. I don't see any abnormal heaving over the valvular areas of her heart. I will now palpate. I feel no thrills. I feel no abnormal vibrations on the valvular areas of her heart. Now I would listen to her heart. I would listen to the correct cardiac sounds with the bell and the diaphragm on my stethoscope. I would also listen while the patient is in the lying and in a sitting position. If I can't hear any cardiac sounds, I would, because of chest obesity or because of breast tissue, I will sit the patient in left lateral decubitus position. So now I will listen to her heart sounds. Aortic, harmonic, earth point, tricuspid, mitral. I hear normal S1, S2 heart sounds. I hear no murmurs, no S3, no S4, no gallops, and no rubs. So I've now listened to her heart sounds. I have also I have inspected the areas of her heart. I've listened to her heart sounds. I have palpated and I find no abnormalities. We're almost done. So now I will check for capillary refill. May I see your hands? I will press down on the fingers, both hands. Capillary refill is normal of less than 2 seconds. And there's no abnormalities, and the capillary refill is brisk. So I've now tested her capillary refills. I will now go and I will test her for peripheral edema. I'm taking my fingers and I'm simply I know no peripheral edema of the upper extremities, including the hands, or the lower extremities, including the feet. I will now test her pulses. So I have test them bilaterally. Her brachial pulses, her radial pulses. Her femoral pulses are down in here. I would check those, but I'm not. Popliteal pulse. Posterior tibial pulse, dorsalis pedis pulses. Her pulses are strong and intact symmetrical and 3+ in quality. Now I'm going to take my hands and check for the temperature of her skin. Her skin is warm to the touch. Checking the abdominal area, the abdomen is concave with no visible scars. I'm checking right here. I see no abnormal heaves, no excessive bowel activity across the bowel. I see no bruises, no venous patterns or engorgement of veins around the umbilicus. I will now listen. I've inspected it now and I'll auscultate the areas, the 4 quadrants. The bowel sounds are normal, active across all 4 quadrants of the abdomen. Across all 4 quadrants of the abdomen. I will also auscultate the arteries, the arteries of her abdomen. Abdominal aorta, renal artery, femoral artery. iliac artery, and femoral artery is down here. I noticed no abnormal blood turbulence, no venous homes. I noticed none of that over the abdominal aorta, renal, iliac, and femoral arteries of the abdomen. I've auscultated, I've palpated it. I will now palpate the abdomen, starting with the left right quadrant. I palpate no masses. I palpate no areas of distension and no tenderness in her abdomen. So I have did the abdominal assessment, and I will percuss the abdomen. There was normal bowel intonation upon percussion, and this concludes my head to toe assessment. Thank you.